What if the pills you take every morning to protect your heart are quietly draining your energy, slowing your metabolism, and affecting your quality of life in ways no one warned you about? Every patient should discuss with their doctor. Because managing blood pressure should never come at the cost of your vitality, clarity, and overall well being. I'm Dr. Sophia Carter, and in my years of medical practice and research, I've seen how the right treatment can transform a patient's life, and how the wrong one can quietly erode it. So stay with me, because what you learn today could change how you think about blood pressure treatment forever. Understanding the bigger picture. Let's start with a reality that's often ignored. Not all blood pressure medications work the same way for everyone. What's safe and effective for one person can cause serious side effects in another. Doctors often follow standardized guidelines, which are important for consistency, but they don't always account for individual differences like age, gender, metabolism, and other health conditions. That's why so many people tell me, "Dr. Carter, my numbers look perfect, but I feel worse than before I started taking these medications." If that sounds familiar, it's not your imagination. Some medications control the numbers, but quietly harm your energy, your mental sharpness, your mood, or even your hormonal balance. The good news is that you have options, but the first step is understanding what to ask your doctor about. Medication class numeral 5. Alpha blockers. These medications like prazosin, doxazosin, and terazosin were once very common for blood pressure control. They work by relaxing blood vessels, which helps lower pressure. But here's the problem. They can cause sudden drops in blood pressure when you stand up, leading to dizziness, lightheadedness, and dangerous falls, especially in older adults. Research has shown that people over 65 who take alpha blockers are significantly more likely to experience serious injuries from falls. They can also cause persistent fatigue, leaving patients thinking they're just getting older, when in reality, their medication may be the reason for their constant tiredness. If you're taking an alpha blocker, it doesn't mean you should stop, but it does mean you should ask your doctor whether a safer, newer alternative might be more appropriate for your age and health profile. Medication class #4. Non-selective beta blockers. These include propranolol and nadolol, and while they can be helpful for certain heart conditions, they can also have far-reaching side effects when used primarily for blood pressure. Non-selective beta blockers don't just slow your heart rate, they slow your metabolism. Patients often experience unexplained weight gain, reduced exercise tolerance, fatigue, and even mood changes like depression or brain fog. If you've ever felt sluggish, gained weight despite eating well, or noticed your motivation drop after starting these medications, it's worth discussing this with your healthcare provider. Selective beta blockers and other medication types might control blood pressure just as well without impacting your metabolism or mental health. Medication class #3. Thiazide diuretics. These are often the first medications prescribed for high blood pressure. Hydrochlorothiazide and chlorthalidone are the most common. They work by helping your body release excess salt and water, but they also flush out essential minerals like potassium, magnesium, and zinc, which are critical for muscle, nerve, and hormone function. Over time, this can lead to chronic fatigue, muscle cramps, and for some men, sexual side effects that can seriously impact quality of life. For older adults, these side effects are even more pronounced, often mistaken for just aging. Some studies also suggest an increased risk of developing insulin resistance and blood sugar issues when taking these medications long-term. If you've noticed new fatigue, muscle weakness, or changes in your energy since starting a thiazide diuretic, bring it up with your doctor. You may still need medication, but a different class might suit your body better. Medication class #2. Centrally acting agents. Medications like Clonidine and methyl-dopa work by reducing nerve signals that tell blood vessels to tighten. That sounds simple, but the reality is more complex, and the side effects can be challenging. Because these drugs act on the brain, they can cause sedation, brain fog, and low mood. Some patients describe feeling mentally dulled or having memory issues that mimic early cognitive decline. Even more concerning, if you miss a dose, your blood pressure can rebound sharply, increasing your risk of a serious event. These medications are usually best reserved for very specific situations, not as first-line treatments. If you're taking one and experiencing fatigue, mental fog, or mood changes, don't stop it. Suddenly talk to your doctor about a gradual and supervised switch to something better suited to your needs. Medication class has shown. Combination pills. Combination pills often include 2 or more medications in one, like a diuretic with a beta blocker. While they're convenient, they can also mask which medication is causing side effects, making it difficult for your doctor to fine-tune your treatment. Many patients I've worked with have taken these pills for years, thinking the fatigue, brain fog, or weight gain were just part of aging. When we simplified their treatment plan, their energy, focus, and overall well-being often improved dramatically. If you're on a combination pill and not feeling your best, it's worth asking your doctor whether those medications could be separated or adjusted individually. A patient's story. Let me share one story that shows why these conversations matter. A 7-year-old patient named Robert came to my clinic exhausted, mentally foggy, and discouraged. His blood pressure was perfect on paper, but he felt miserable. He'd been taking a combination pill with a diuretic and a beta blocker for nearly 5 years. We gradually transitioned him under close supervision to a single medication that better suited his profile. Within a few months, his energy returned. He lost weight naturally, and his mental clarity improved. His blood pressure stayed well controlled. The lesson here isn't that medications are bad, it's that personalization matters, better alternatives, and lifestyle support. For many patients, safer and more tolerable options include ACE inhibitors like lisinopril or enalapril, ARBs like losartan or valsartan, calcium channel blockers like amlodipine. These options can control blood pressure effectively while minimizing metabolic, sexual, or cognitive side effects for most patients. But medication is only part of the equation. Lifestyle choices like balanced nutrition, physical activity, stress management, and sleep can make a huge difference. In some mild to moderate cases, these changes alone may reduce the need for multiple medications. Your next steps. If you're currently on any of the medications we discussed today, don't panic, and definitely don't stop anything suddenly. Instead, take a moment to document what you've been feeling. List your symptoms, fatigue levels, changes in mood, sleep quality, energy, and weight. Bring this list to your next doctor's appointment and say, could these symptoms be related to my medication? This one question can open a conversation that changes your life. And if your current doctor doesn't take your concerns seriously, consider getting a second opinion from a cardiologist who focuses on personalized care. Your health is not just about numbers, it's about how you feel every single day. Final thoughts. Blood pressure control is important, but it should never come at the expense of your energy, mental clarity, or overall quality of life. The right treatment plan is the one that keeps your numbers in range and helps you feel your best. Remember, your body gives you feedback every day. Listen to it, document it, and use it to advocate for yourself. You deserve more than stable blood pressure. You deserve vitality, clarity, and longevity.